Hi, I'm Erin Petersilie, the Kansas Farm Bureau Health Plans Manager, and welcome to a conversation about Medicare, and specifically Medicare supplement plans, Medicare Select supplement plans, and Medicare Advantage plans. When we start talking about Medicare, when we first off refer to original Medicare, Medicare Parts A and Part B, and this is what handles Part A does the inpatient hospital, skilled nursing, home health hospice, where Part B does providers charges, durable medical equipment, has some outpatient facility care, all those sort of things goes under Part B. But I really want you to focus on specifically the gray and the white, and not so much all the fine details on this. But you can see that there are some gray pieces, and that is what Medicare is going to cover. And we see a lot of white on this, and that is what you are going to be financially responsible when it comes to visiting the doctor or being in the hospital or in a skilled nursing facility. So we look at that, and that can be really daunting to people. And how do we really protect ourselves from that financial burden? And there are some different ways that we can do this, and we're going to talk about those. We're going to kick it off here with Medicare Advantage plans. As we get talking about any of these plans that are going to help fill in the gaps that you saw there, so fill in those white spaces, I want you to think about this as a marriage, okay? So I tell people, when you are making this decision, I want you to pick once, pick what you can afford, and stick with it. Not that you can't get out of it, but it can be difficult. There can be some issues when you try and do that. So really know what your options are, get some education regarding it so that you can really make those good, sound financial decisions that are going to carry you through retirement. So let's talk about Medicare Advantage plans. Usually when I'm working with people, this is what they refer to as, well, I see those commercials on TV that say I might not have a premium, or that my drugs and I can have dental and vision and all of this wrapped up into one plan. There are some differences amongst these plans. They do work differently than what a Medicare supplement plan or even the select plans. So when you choose a Medicare Advantage plan, it's going to replace Medicare Parts A and Part B. They're very network driven though. And so there's different rules, and there's co-payments and all those sort of things that just work very differently. One thing to really understand about them is they're not necessarily very portable. In the state of Kansas, we don't have a widespread set of doctors and hospitals that accept these plans. So it can be very hard to get the coverage, the help that you need, etc. When you're seeking those medical professionals. Again, it's not that it can't happen, but it's just not as widespread. So make sure that you know just what you're getting into with any of these, and so that you really understand how they can best be used to protect you financially. Medicare Select plans, these are very, very new for us here in the state of Kansas. They are not widespread at all. They are not even sold in all counties. So again, they fill in the holes of Medicare, just like a Medicare supplement plan. However, it's again goes back to being very limited with the coverage to the networks of doctors and hospitals, and they function very much like an HMO or a managed care plan. The most common thing we see here in the state of Kansas is a Medicare supplement insurance. And the reason they are so common is because as long as your doctor or hospital accepts Medicare, they're going to accept the Medicare supplement plan. So there is no need for you to have to worry of, does my doctor or hospital accept Kansas Farm Bureau or any of the different companies that are offering Medicare supplement plans? All you need to worry about is, does your doctor or hospital accept Medicare? And if they do, they will accept your supplement plan. So it's a great way to really compare apples to apples. When we look at this, before 2020, people had the option to choose between 10 different plans. And your eye probably went to, well, what fills in the most gaps? And that was Plan F. Plan F filled in every single gap. As long as it was a Medicare eligible, Medicare picked up its portion, your Medicare supplement picked up the end, and it really left you with very little financial exposure. But since 2020, so if you were not eligible for Medicare before December 31st, 2019, then you do not have access to Plan C or Plan F. So if you turned 65 in January, you could not purchase a Plan C or a Plan F. So we went down to 8 plans. The most common that we see people doing is a Plan G. And just because it's the most common doesn't mean it's the right thing for you to do. However, Plan G fills in the next most gaps there. It does fill everything but the Part B deductible. Remember that the Part B deductible for 2020 is $198. So you would pay the first $198 for the year, and then your supplement would come in and pick up the rest. So the different plans have different levels that they are taking care of, different pieces that they are taking care of. And again, it's all about you making the right decision for you. When we talk about eligibility for these plans, you need to be a resident of the state of Kansas. However, should you choose to leave, whether it's because you're going to retire somewhere else eventually, or you want to travel, whether you want to see grandkids, kids, whatever your reasons may be for wanting to move outside of the state of Kansas, you can do that. Your plan is going to go with you. You have to be enrolled in Medicare Part A and Part B and be 65 or older, be under the age of 65 with disabilities or end-stage renal disease, but you cannot be covered with multiple Medicare supplements or Advantage plans. So you can't pick, oh, I want a Medicare Advantage plan for when I'm here and I want a Medicare supplement plan for when I'm here. Doesn't work, not something you're allowed to do, so you need to pick one. When you are first eligible for enrolling in Medicare, whether it's because of your initial enrollment of, hey, I'm turning 65 and I'm retired and this is how I'm going to take care of my health insurance, or if it's because later in life is when you choose to retire, you're going through a guaranteed issue period, meaning we can't turn you down. So let's work through a couple of examples. So let's say I'm turning 65 here next month and I want to pick up all my pieces of Medicare. I can do that, no problem. They cannot ask me any questions whatsoever, okay? Because I'm guaranteed issued. I'm within that certain applying deadlines. It does not matter if I have had heart disease or I've had a stroke or I've had cancer. No medical questions. You're like this brand new baby chick with no issues whatsoever. Okay, no, nothing is going to be asked. And that's not always the case. So another example would be, maybe I'm going to keep working, okay, or my spouse is going to keep working. I've got my health insurance needs taken care of elsewhere. And, you know, I'm turning 67 and that's going to change. I'm, you know, ready to maybe take it a little bit easier, although most retired people tell me they work more in retirement than what they did before retirement. But now my health plans needs have changed. Again, I've had credible coverage through my company, through my spouse's company, whatever it may be that way, and I'm ready to take on Medicare. Again, as long as I do it within the time frames that have been set, I'm going to be guaranteed issued and I won't have to answer any of those health questions. Every once in a while, I will tell you that I do see people that just ignored Medicare whatsoever. They didn't want to enroll, and then that gets into some different enrollment issues when we get to that. But let us know if you need help with this. There are lots of resources for you to be able to reach out, get the credible information you need that can help you make the decisions that are good for you. So let's say that I just ignored this, okay? Like I started in earlier of, you know, I turned 65, I picked up my Medicare Part A and Part B, but I didn't really want to deal with a Medicare supplement plan. You know, I'm healthy, I don't see the doctor, I don't really want to maybe spend the expense to pick up a Medicare supplement plan. And you can do that, okay? And people do. Wouldn't be what I would recommend. It'd make me a little nervous personally. But then let's say 5 years down the road, you know, I'm now 70, you know, I'm probably going to start using the doctor a little bit more at that point in time, because I am not in a guaranteed issued time period. I'm going to have to answer underwriting questions, and I can be accepted or denied based on those things. And what we have up here on the screen right now is going to be the underwriting questions that we are looking at with Kansas Farm Bureau. There could be other things. Different companies will have different guidelines, but this would give you an example. You know, so if I've had cancer, you know, I'm going to be denied here with this. So again, it's all about making the right decisions at the right time so that we can protect against financial risk. Okay, so the effective dates that people want to know about. So let's say I want Medicare to kick in the month that I turn 65. So for me, that's going to be January. So January 1, I want my Medicare to start. Up to 3 months before I turn 65 is when I can enroll in a Medicare supplement plan. and it's not going to start early, but it would start January 1st for me. All the policies are effective the first day of the month, but if you enroll the last day of the month, they can be ready to go for you the first day of the month. So like January 31st, maybe you want your plan to start February 1st, you can enroll January 31st and it's ready to go February 1st. As I mentioned earlier, there are a lot of great resources out there. Medicare.gov, ksinsurance.org, and SSA.gov are all great resources. If you really want to work with somebody in person who is going to provide you with great educational materials and not sell you anything, but really help you be able to ask those questions and figure out what you need, our great resource in the state of Kansas is SHIC, our Senior Health Insurance Counseling for Kansans, and they can be found at www.kdads.ks.gov. These are people that are located in our communities all across the state and a wonderful resource. If you have any questions that you would like to ask of me, please reach out to me. You can email me at kfbhealthplans@kfb.org, and you can also find out more information on our website at kfbhealthplans.com.